Hi and welcome. You're tuned in to D Island Docs. I am Dr. Sandy and this is my co-host Dr. Gordon, and we're here to talk all things health and health related. Today our topic, it's a women's episode. It's about women's health. We'll be talking about the uterus, the cervix, the ovaries, the vagina, and guys, this is not something that, you guys should turn off the TV for. You also need to know about these things because you all have mothers, wives, girlfriends, and we'll start with like cervical cancer, fibroid uterus, and endometriosis as some of the topics that we're going to go through today.
Right, so cervical cancer is the third most common cancer in women, and the signs and symptoms of this is abnormal vaginal bleeding, vaginal discomfort, malodorous vaginal discharge, as well as sometimes you can have urinary tract symptoms. So these are some of the things that when it happens, you need to bear in mind that it might be cervical cancer.
Definitely, and we also need to know the risk factors. And some of the risk factors are if you have sex at a very young age, or if you have multiple sexual partners, or if your male partner is a promiscuous partner, or if you have a history of STDs. This puts you at an increased risk for getting cervical cancer.
Now, cervical cancer is one of those cancers that we have found that the causative agent is actually an HPV, which is a type of virus.
Yeah.
So it's a viral infection, which means if it's an infection, this is something that can be preventable.
Yes,
so
definitely.
we can treat the cervical cancer, by even not necessarily treating, but we can prevent cervical cancer from happening by doing our screening with pap smears.
Exactly, and that's why doctors stress so much that we absolutely need to get our pap smears done. From the ages of 21 to 29, you're supposed to be getting a pap smear every 3 years. So it's very important that if you are out there, you are between that age, you haven't had a pap smear, that you definitely schedule one. It's so important that I myself volunteered to go get a pap smear done just to show you that it's an easy, simple process. So let's take a look at that.
No, wait, before we get on to that, we need to talk about that vaccine that's out there.
Oh yeah, that's true.
We have to talk about that vaccine that's out there. Now, this vaccine is available from earlier ages, so from 9 to 26.
Definitely.
So it's out there. It's a vaccine. It protects against certain strains of HPV, 6, 11, 16, and 18. I mean, the numbers don't really mean much to you, but it does prevent you from getting HPV, and HPV has been linked to cervical cancer. So this is one of the first foremost we can take a vaccine to prevent cancer. That's a mind-boggling thing, because cancer, we don't necessarily have a grip on it right now.
Exactly.
But this is one instance where we do.
Definitely. So let's get to it. Let's take a look at my pap smear at the doctor's office. Hi.
Hi, Renee. How you doing?
I'm good. How are you?
Fantastic. Good. Glad to see you.
Thank you so much for having us on the show today. This is Dr. Ahmadi, and he's our GYN for the show.
Good morning, everybody. How you doing?
I'm good. I'm here for my annual pap smear. Let's go.
Great. I'm going to ask you to go ahead and get changed. And cover yourself with the sheet, and I'll be in a few minutes.
Okay.
All right.
In.
Great. I'm going to pull out this lower part here for you. Just put your legs straight and just lie back for a second. Take your blood pressure. All right.
You see what I do for the show?
The sacrifices.
Yes. Now, can you tell the audience, why is it important for a young woman to have a pap smear done?
Pap smear is a screening test for cervical cancer. So it should be done once every year. After 3 normal pap smears, you can probably go to every 3rd year. And also we should have periodic testing for the human papillomavirus. And the human papillomavirus is the virus that's associated with cervical cancer.
Okay.
There are some that are high risk and some that are low risk. So the pap smear that I'm going to do for you today is not only going to look at the cells to see if they're normal or abnormal, but we're also going to test you to see if there's any evidence of the high risk HPV that might be problem.
So you recommend that you do the both of them together?
Usually we start testing on women over the age of 30 because it's very prevalent. You get it by sexual intercourse, and usually your body will fight it off by itself within 2 to 2.5 years.
Okay.
But in those women that persist after the age of 30, then it might be some problematic. So we go ahead and test everybody after the age of 30.
Okay. All right.
Okay?
Yeah.
Any other questions before we proceed?
No, that's it.
Fantastic.
Still have a smile on my face. Now for you guys who haven't had one, it's actually not very painful. So it's quick, it's simple, and it's something that every woman should get done.
Yes. Take a deep breath in, out, in again, out. Now you're going to feel a little pressure as I open up the speculum. I'm going to take the pap smear. You're going to feel like a little scratching sensation. Okay, that's it. Take a deep breath in, out. We're done.
Oh, that was it. So literally less than 5 seconds, guys, and it's all over. Thank you so much, Dr. Ahmadi. You know, literally a pap smear takes less than 1 minute, guys. So be sure to schedule your next pap smear. We must take a break now, but we'll be back and we'll be talking about fibroid uterus. So stay tuned.